Have you ever been diagnosed of high cholesterol level, or you have a friend, a close relative, or someone very dear to you that has been diagnosed of high cholesterol level? And you're thinking, how can I help? What can I do to reduce the high cholesterol level? It's actually a good one. This particular video is for you. And I also want to let you know that having high cholesterol level puts you at risk for heart disease and also stroke. Good day everyone and welcome back to Nurses Lecture Room YouTube channel. My name is Mercy Mary and today I'm going to be sharing with you 7 ways to reduce your cholesterol level. Yes, but the first question is, what do you mean when you say high cholesterol level? In a layman's language, high cholesterol simply means that you are having an increased amount of a particular fatty substance known as cholesterol in your blood. Yes, you are having a particular amount, a high amount of that fatty substance known as cholesterol. You may want to ask, what figures are we looking at? So when you go to the doctor, they check the total cholesterol level, they check your total cholesterol level, they check the amount of your high density lipoprotein cholesterol. This high density lipoprotein cholesterol is a good one, is a good cholesterol. And they also check the bad cholesterol in your body. So you are checking the total cholesterol, the high density lipoprotein cholesterol, and also the bad cholesterol, which is known as the non-HDL cholesterol. So the total cholesterol is the combination of both the high density lipoprotein cholesterol and the non-high density lipoprotein cholesterol. That is the total, the check. The high density lipoprotein is more or less like the good cholesterol in the body that doesn't put you at risk for stroke. It doesn't put you at risk for heart disease. This one is good cholesterol. While the non-high density lipoprotein, which is the bad cholesterol, this is what puts you at risk for stroke. It's what puts you at risk for heart disease. And to get the value, you're going to be subtracting the total cholesterol from the high density lipoprotein cholesterol. So what values are we going to be looking at now? For the total cholesterol, the amount we should be getting is below 5 millimole per liter. While for the high density lipoprotein, we have 2 values, one for the men and one for the women. For the men, we are going to be looking at values above 1.0 millimole per liter. And for the women, we're going to be looking at 1.2 millimole per liter. Then that takes us to the last one, which is the low density lipoprotein. This should be below 4 millimole per liter. So your low density lipoprotein, which is the bad cholesterol, should be below 4 millimole per liter. And how do they get this figure? They subtract your high density lipoprotein for your total cholesterol. I don't know if I'm making sense to you now. So that is that. So back to the question of how do we now reduce it? We want to reduce it. What can we do to reduce that cholesterol level because it's not good? So the first thing you have to do is to reduce your fatty food intake. Yes, if you eat too much of fatty food, it is time for you to reduce it, especially when your doctors have diagnosed you of high cholesterol level. And here are the foods that you can eat and cannot eat. For the food that you can eat, you should eat more of oily fish, mackerel, and salmon. You should eat more of brown rice, whole grain bread. You should eat more of whole wheat pasta, nuts and seed, fruits and vegetable. These are the food you should eat more. More fruits, more vegetable, more nuts, more whole grain, more oats. All these things, they don't affect your cholesterol. Then you should eat less. I'm not saying you should stop it totally. Eat little of meat pies, sausages, fatty meats. You should eat little of butter, lard, cream, hard cheese like cheddar. You should eat little of cakes and biscuits. And you should eat little of food that contains coconuts and palm oil. So these are the food you should eat and you should not eat, especially when you are trying to reduce your cholesterol level. Then the second thing that you should take note of is for you to exercise regularly. Yes, the amount of exercise you do a day is going to go a long way to affect your cholesterol level. At least you should be doing 120 minutes of exercise in a week. But if that is too much for you, try and do it little by little and get used to exercising. The more you exercise, the more your heart becomes active, the more your body generally becomes active. So me personally, I don't have high cholesterol, but I'm trying to include exercises in my daily activities, because most time I get lazy because I feel when I go to the NHS, the walking around, taking care of patients is more or less like my walking exercise and things like that. But if you are not active, you are not doing strenuous exercise, it's advisable for you to exercise, not really lifting weight. Run, you can jog, you can do some jumping. Just make sure your body is active. That's going to go a long way with managing the cholesterol level. Now take me to the third thing that you should not do, and that is smoking. You see, smoking doesn't really have any health benefits that I'm aware of. Smoking has more harm than good to your body. It does a lot of things. It can damage your kidney, your liver, your lungs. It does a lot of harm than good. Let me tell you what happens when you stop smoking as someone with low cholesterol level. First of all, within 20 minutes of not smoking, your BP and heart rate recover from the cigarette-induced spike. Within 3 months of not smoking, blood circulation and lung function improves. And within 1 year of not smoking, you reduce the risk of heart disease by half compared to those that smoke. So this is me advising you, do not smoke. I got this information that I just shared with you from Mayo Clinic online.com. So that's where I got the information. So try as much as possible to reduce smoking. All right. Then the fourth thing I have to share with you is reduce your alcohol intake. You see, smoking and alcohol, I think they are brothers and sisters, because most times when they are teaching health education, they call alcohol. The next thing they call smoking. Especially when you know you are not healthy, you're having heart issues, you're having cholesterol issues, reduce your alcohol intake. Or if possible, stop your alcohol intake and replace it with some natural, fresh juice and fruits. That is going to go a long way to help. Then the fifth one I have to share with you is weight loss. Yes, if you are overweight, if you are obese, it is advisable for you to exercise, reduce that weight as much as you can. Because having a low, like an average BMI, not a low BMI, a good BMI where you are not overweight or underweight generally is good for your health. So try as much as possible to reduce weight. Then that take me to the sixth point I want to share with you. Most times, not sometimes, having high cholesterol level, lifestyle cannot sort it out generally. So that is where you get your doctors to prescribe some anti-cholesterol medication, things that will help fight that cholesterol, such as your statins. Statins are usually the medications used for cholesterol level. So your doctor is likely going to prescribe that to help reduce your cholesterol level. But while on that medication, also do some lifestyle changes. It's going to go a long way. Then the last one, which I have to share, is laugh more. Laugh more. Be positive, stay happy. Because when you are happy, there's a release. According to one of the researcher or one doctor I saw on it, and it was like, when you are happy, you tend to release the good cholesterol, which is the high density lipoprotein. But if you are not happy, you don't have high density lipoprotein, your amount will not be increased. Let's put it that way, okay? So try and laugh more, try and go out, try and hang out with friends, try not to be lonely, try to associate yourself with people, try to stay positive, try to ward away negativity and live a joyful life. And also to live a joyful life, just know that you can't get everything. So whatsoever stage you are in life, be happy at that particular stage while working towards a better stage in life. Because I found out that most people are not happy because of the next stage they want to get to, because of the next goal they want to accomplish. Yes, it's good to accomplish goals, it's good to move up the ladder, but at that particular stage you are in the ladder, be happy while trying to move towards the other stage of the ladder. Okay, so this is what I have to share with you in helping you lower your cholesterol level. If you have any concern, kindly drop on the comment section and I will be here during the 90 days to take all your questions. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.